The Bow tax. As part of the health care bill, Senate Democrats want to tax Botox and other cosmetic surgery.
We're joined now from Birmingham, Alabama, by facial plastic surgeon Dr. Danielle Rousso. Good to see you, Dr. Rousso. We just want to mention some details here about how much 4.7 million Botox injections last year. Average cost per visit about $400. That's about $1.8 billion. If they tax these Botox injections, and they're talking about taxing other things like breast implants and tummy tucks, do you think there will be fewer of these procedures?
Well, I think that it certainly will be borne by the brunt of the patients who are having these procedures done. Women really will be unfairly targeted in this whole tax situation because 86% of the patients that undergo cosmetic surgery are women, and so it's really a discriminatory tax in that respect.
But doctor, what else would it do? And I'm interested to know how you think it might then affect the companies that manufacture things like breast implants and Botox, Restylane, all of the injections that would be subject to this tax if it were to go through.
Well, I think it will significantly affect them. Obviously, it all boils down to the bottom line, and if you put a 5% tax on all of these procedures that are being done, then you ultimately will probably see a decrease in the purchasing of these particular products as well. So I would imagine that it will have an effect without a doubt.
Now, a 5% tax on a millionaire is not going to affect their decisions that much, but a 5% tax on a middle class could. It's often portrayed, these Botox injections, as something that just the wealthy use. Is that your experience?
Well, obviously that is not the case. It's a really strong misconception that this is only being done by people that have a lot of money. And there's many studies that show that about 60% of the people that undergo cosmetic surgery or have cosmetic surgical procedures done have a household income of between $30,000 and $90,000. So certainly these are not millionaires that are having this done. So the majority of the people undergoing this type of surgery are average working people.
But doctor, let me play devil's advocate here. It's elective surgery, and it's sort of, if you could liken it to anything, and I'm not sure this is an appropriate analogy, but when they go for, in many municipalities and states, for the cigarette tax, yes, smokers are annoyed, but everybody else says, well, I don't smoke, and it's not great for me, it doesn't affect me, it's elective. Do you see that point of view, that if they're looking to tax something, it's going to be the elective stuff like Botox injections?
Well, let's talk about the cigarette, because I think that's a good example. Cigarettes, we know, cause multiple health problems. As patients get older, they have pulmonary problems, they have other issues of this nature that really are significant health problems that cause a significant burden to the rest of our society to take care of these people as they get older. So therefore, there is a reason, a potential reason anyway, to tax those particular items, because we're ultimately having to pay for those kinds of problems as people get older. But elective cosmetic surgery certainly is not that case. These people have saved up money many times for a long time to try and undergo some procedures that they want to have they would not otherwise be able to have. By imposing an additional tax on top of what they've saved for will oftentimes keep them from being able to afford these kinds of procedures.
And wealth taxes never work, whether they're on mink coats or luxury yachts. They always end up discouraging purchases and bring down the revenue. That's why they usually get rid of them. But you didn't lobby actively against this tax before. We should mention, are the head of the American Academy of Facial Plastic and Reconstructive Surgery. Why didn't you? What made you think that this wouldn't be in the bill?
Well, when we first caught wind of this coming from the Senate committee, we were told, actually, that they were not going to consider this, because it did come up in multiple conversations, and we were told that this was something that was not going to be on the table. And so therefore, we did not actively lobby, because again, we were told that it was not going to happen.
Dr. Danielle Rousso, thank you very much for joining us to talk about the Bow tax. We like the name, it's certainly creative, but we'll be watching this closely.
Thank you, Doctor.
As I'm sure you will too.
Appreciate it.